let's be honest. Our health systems are really struggling. They were designed for a different time, to fix sudden things, like a broken arm or a bad infection. But today, they're just completely overwhelmed by something they were never built to handle: chronic disease. So the real question is, how do we fix a system that feels like it's stuck in the past?
And that's really the core question we're going to tackle. Because right now, the way we deliver care is often scattered, it's inefficient, and it's failing millions of people who have to live with ongoing health issues every single day.
And if you want to get a sense of just how big this problem is, well, this number says it all. In the United States, a pretty staggering 80% of every single dollar spent on healthcare is for patients with one or more chronic conditions. I mean, that's not just a line on a budget, it's this massive economic weight pulling the entire system down.
But here's the thing, this isn't just about the money. It's about people. This rising tide of chronic disease means a lower quality of life for so many, and it hits the most vulnerable people the hardest, which just makes inequality even worse. So clearly, what we've been doing just isn't working anymore. We absolutely need a new way forward.
So, what's the game plan? Well, here's what we're going to walk through. First, we'll look at exactly why the system is under so much strain. Then, we'll explore the solution, which is called integrated care. After that, we'll dive into a practical framework for making it happen, look at what it really takes to make it work, and finally, we'll uncover the real key to success.
All right, first up, let's break down precisely why our traditional model of healthcare is falling so short when it comes to chronic disease.
The root of the problem is a total mismatch. Our system is designed for one-off, acute issues, but it's just not built for the long marathon of a chronic condition. It's totally fragmented. We wait for people to get sick instead of trying to keep them well. So it's reactive, not proactive. And the funding? It's all chopped up into different silos. This leaves patients trying to navigate a super confusing maze of providers all by themselves, which is not only frustrating for them, but also incredibly inefficient for everyone involved.
So, if the old model is broken, what's the fix? Well, it's an approach called integrated care, and it really represents a huge shift in thinking, away from just treating specific diseases and toward truly caring for people as a whole.
So what exactly is integrated care? Well, at its heart, it's all about creating a structured way to provide care that's coordinated and proactive. And look at the keywords here: person-centered and multidisciplinary. This just means getting everyone, your doctor, the nurses, any specialists, all working together as one team, with you, the patient, right at the center of it all.
Now, for this to really work, integration has to happen on 3 different levels at the same time. At the micro level, that's the patient's direct experience, the clinical side. At the meso level, it's about getting different organizations and professionals to work together. And finally, at the macro level, you've got the entire system. We're talking policy, funding, the whole shebang. You can't just do one of these. They all have to be working in concert.
Okay, so knowing what integrated care is one thing, but knowing how to actually do it, that's the real challenge. And that brings us to the core of this whole explainer, a really practical framework with 12 key strategies for making integrated care a reality. The first chunk of strategies is all about leadership and governance. It has to start with getting everyone, patients, doctors, policymakers, you name it, in the same room to build genuine trust. It means breaking down those leadership silos and making absolutely sure that the care is centered on the person and their community.
And this isn't just a theory. Check out this example of that leadership in action. In Hungary, a fantastic network for cancer patients called Onco Network really took off because one visionary hospital director managed to convince physicians to try a new, more coordinated approach. It's perfect proof that sometimes real change starts with one dedicated person who has a clear vision.
All right, next up, money and data. 2 things that can make or break any big change. This means first, creating feedback loops so you can actually track what's working and what's not. And second, it means getting away from short-term grants and securing stable, long-term funding. You just can't transform a whole healthcare system with pilot projects. You need sustainable investment that actually rewards working together. A brilliant example of this is a project in Germany called Gesundes Kinzigtal. They used a 10-year shared savings contract. Basically, by pooling their resources and agreeing to share any savings that came from better, more preventative care, they created this powerful incentive for everyone to focus on keeping people healthy, not just treating them after they got sick. It's a total game changer.
Okay, this next part is all about the people and the tools that make this whole thing run. First, you have to build a true team culture where everyone feels like they're on the same page.
This often means creating brand new jobs like care navigators, whose whole purpose is to guide patients through the confusing system. Of course, this also means we need to totally rethink how we train our healthcare professionals for this new world. And finally, technology has to be more than just a digital filing cabinet. It needs to be the engine that actually powers collaboration and connects everybody.
The last two implementation strategies are about how you actually deliver the care itself. And you'll see a theme here. It's a balancing act. You have to carefully build on what's already working while still being open to big, game-changing ideas. It really is all about finding that sweet spot between formal structures and day-to-day flexibility. And this is exactly the critical balance we're talking about. See, on one side, you have formal structures. They give you accountability, standards, and they make things last. But on the other side, you need flexibility. That's what allows for truly patient-centered decisions and gives professionals the autonomy they need to adapt to unique situations. You absolutely need both. Success is found right there in the middle. So we've gone through 11 different strategies, but there's a 12th one, a kind of meta-strategy. That's the glue that holds everything together. It's the real secret to making this all work. And that crucial final piece of the puzzle is this one powerful word, alignment. Because here's the thing, none of the other strategies we talked about can work in a vacuum. They're all just gears in a much bigger machine.
So, the 12th strategy is to actively align everything else. It means making sure that your leadership, your funding, your workforce, and your technology are all pulling in the same direction. It means tackling those micro, meso, and macro levels all at the same time. When every single piece is working together in harmony, that's when you create the kind of supportive environment where integrated care can truly flourish.
So after going through all of this, what's the one big idea you should take away? Well, it really boils down to a fundamental shift in how we think about what a health system is even for.
And that leaves us with this final, crucial question to think about. This transformation isn't just about new flowcharts or different payment models. It's about a deep cultural shift. So how can we move our health systems away from just treating diseases after they happen and toward actively co-producing health and well-being with people and their communities? Answering that question, that is the ultimate goal of integrated care.